Welcome back to movementprofessional.com. So this video is in response to a question I got from a University of Scranton alum, Katie Berg. She reached out to me and was asking about having a tight right hip. She was reporting that when she flexes and externally rotates her hip, it pops and just feels super stuck and unstable. And then she also mentioned that when she sits for an extended period of time in a car or on a couch, the right side of the lower back tightens up and can be very painful. So unpacking both of those together, I can give some suggestions. I can't obviously make a definitive diagnosis, but one of the things that comes to mind is that with sitting, the weight is likely shifted a little bit too much to the right, and if the weight bearing is a little bit more to the right, the hip can be biased in a internally rotated position, internal rotation and extension. So with sitting for a long period of time, there just can be more weight bearing going through that right side. And then when attempting to flex and externally rotate, if the hip is already biased into a little bit of extension, internal rotation, there may be a little bit of a popping or a clicking sensation or a feeling of it being stuck when going in that direction. So we could break this down in two different ways. One, we want to be able to get right glute max activity because that is a external rotator. But we want to think about using this right leg as a reacher or a pusher to get us over to the left side a little bit more. So I'll demonstrate some exercises to get some right glute max activity as an external rotator in various positions on the ground, and then we'll look at sitting in a chair on a bench and how we can use that idea of reaching the right leg and pushing us to the left side just so you can get off the right side a little bit and maybe decrease the compression on that right low back. All right, so if we look at external rotation in sitting for this right side, we can go, I like to always go into like a 90-90 or a Z-sit position because this leg's an internal rotation, this leg's an external rotation, and we can do a lot of things here to kind of understand the idea of creating a hip shift or shifting weight onto a side or shifting it off. So when we look at external rotation, typically on this side, if I just reach my leg long as if I'm reaching my femur away from the groin, I'm going to be creating an external rotation moment. So what that's going to look like on the ground here, if I'm reaching long, I also want to think my foot is getting a little bit light on the ground. So if I push my foot into the ground and the knee comes this way, I'm moving into internal rotation. But if I reach my knee, say, long and down, then I'll create a little bit of external rotation. All right, so if I can create that sense of reaching and I can feel my right outer butt engage, then I'm creating a little bit of engagement in the external rotator. So what's actually easier in this case, if I bring myself in this position and I start with the internally rotated leg, it's much easier for me to actually feel this glute max engagement with a reaching this way and then bringing my body or my torso away from this leg. This also helps me feel this shift as I'm getting off of my right side and into the left side. So I find this to be a very helpful one to engage the right glute max here because the leg is already in internal rotation. So really any movement where I'm offloading this inner knee from the ground starts to give me a little bit of external rotation, external rotator engagement through there. I can also look at going into sort of like a pigeon, but when I want to be in a pigeon, I want to stay high. So I want to keep this heel away from my groin, and I don't want to fold over because that actually moves me back into internal rotation. So I want to basically use this front shin as a pusher. I'm pushing into the ground, and I'm going to push myself a little bit over to the left hip, so that squares me up to this left hip. And the stronger I am in my glute max here, I'm reaching my leg away and I actually don't even need my hands to be upright. So until you get to that strength there, you can just use fingers or hands or yoga blocks to keep you elevated. But the key is to not fold over the leg, but try to push your body away from the ground. And you should again feel this outer butt working there. All right, so as this gets stronger, this motion of flexion and external rotation often will become more stable and you'll get a little bit less of that clicking. This movement of reaching away also opens up the right low back so there won't be as much compression or falling towards that right side, which might help to decrease the compression there with sitting for a long period of time. When you are sitting, we can look at how to create a seated hip shift. So If you look at me in this oblique angle here, we'll say that the knees are even. So if I want to get off of my right side, I can reach my right knee long, and I can get heavier in this left heel, find my left hamstring, left inner thigh. So I'm basically thinking this leg is coming in, this leg is reaching out, and then I should feel a little bit heavier on my left sit bone. All right, so as I'm doing that, I want to be aiming my knee or my nose over the middle of my knee and feeling like my internal obliques, my abs on the left side, get a little bit more engaged. So this leg is light, this leg is heavy. If I had a band or something here, I could actually reach this and maybe push this knee into a band, and I might be able to increase my activity of my glute max on the right again. But the key, what I would say here, is just to feel your left sit bone a little bit more. And if you can tie in the reference of left heel, hamstring, inner thigh, and then feeling that left sit bone, you're going to tend to be off of this right a little bit. So oftentimes it doesn't mean you want to live here, but when you're sitting for a long period of time, it's nice to have options so you don't just hang out on the same side. And most of us have a side that we're going to prefer, and most of the time it is the right side. So putting the two symptoms together, that would be something I would give a try to, and just being aware of, like, are you on your right sit bone? Can you just shift yourself to the left sit bone? If you can create this type of movement of the hips, it tends to be helpful as opposed to just side bending yourself this way. And then if you want, you could go back and forth, but it's just to give you a little bit of variability in sitting so you're not creating that same load for too long. If you have any questions, you can reach out again, movementprofessional.com. Hope that was helpful.